We saw last time that those who oppose active euthanasia generally appeal to the principle of non-maleficence and the idea that it's prima facie wrong, strongly prima facie wrong, to kill. They would also appeal to the idea that we have healthcare professionals to cure and to care for us, but not to kill us. Those who favor active euthanasia appeal to autonomy and beneficence, saying that patients ought to have the right of self-determination extended to the time and manner of their death, especially in situations where their suffering and the low quality of life they have means that they may actually be better off dead. I also suggested last time that we would be analyzing the debate in terms of the question where lines should be drawn. Is the mere distinction between killing and letting die what matters, or is intention more relevant? Others have said it's neither of these, but our motives. In this presentation, we'll attempt to make sense of the argument in terms of these distinctions. Daniel Callahan's essay, which you have been assigned, is interesting for its focus on the distinction between killing and letting die. He defends that distinction and says it has to do with our recognizing a distinction between ourselves and the external world, and our recognizing that the external world has what he calls its own causal dynamism. I think here's the key passage. The first and most fundamental premise of the distinction between killing and letting die is that there is a sharp difference between the self and the external world. Unlike the childish fantasy that the world is nothing more than a projection of the self, or the neurotic person's fear that he or she is responsible for everything that goes wrong, the distinction is meant to uphold a simple notion. There is a world external to the self that has its own and independent causal dynamism. The mistake behind the conflation of killing and allowing to die, conflation means to put two things together that should be kept distinct, is to assume that the self has become master of everything within and outside of the self. The fact that we can intervene in nature and cure or control many diseases does not erase the difference between the self and the external world. It is as out there as ever, even if more under our sway. That sway, however great, is always limited. So, based on this distinction between the self and the external world, and the external world's own causal dynamism, the fact that things happen apart from our action and our intention, is the basis for the moral importance of the distinction between killing and letting die, according to Callahan. His moral point would seem to be that we are responsible for what we do or cause, killing, but not for what happens in that external world with its own causal dynamism, natural death. There's a problem, however, with Callahan's argument, for he acknowledges that it's not always right or permissible to let a person die a natural death. So the moral judgment he makes is not one that absolutely depends upon a sharp moral difference between killing and letting die. Maybe the best we can say about his reasoning is that it leads to the conclusion that we are more responsible for what we do or cause than what we merely let happen. However, I think we must add that Callahan's reasoning suggests that the key distinction must lie elsewhere than the simple distinction between killing and letting die. After all, he acknowledges that not all letting die is permissible, and as we've seen, our consensus about this is that we may let die only in situations where the life-sustaining treatment is itself extraordinary. So Callahan, as much as he tries to focus on the mere distinction between killing and letting die, his own reasoning suggests that the key distinction lies elsewhere. James Rachel's essay on active and passive euthanasia, which you have been assigned, makes an important contribution to this debate. Rachel's favors active euthanasia, but here what I want to look at is his attack, if you will, on the idea that the distinction between killing and letting die makes any moral difference. The first thing he points to is what he says is the fact that such a distinction leads to unnecessary suffering. Here's what he writes. To begin with a familiar type of situation, a patient who is dying of incurable cancer of the throat is in terrible pain, which can no longer be satisfactorily alleviated. He is certain to die within a few days. Suppose the doctor agrees to withhold treatment, as the conventional doctrine says he may. The justification for doing so is that the patient is in terrible agony, and since he's going to die anyway, it would be wrong to prolong his suffering needlessly. But notice this. If one simply withholds treatment, it may take the patient longer to die, and so he may suffer more than he would if more direct action were taken and a lethal injection given. So, from Rachel's perspective, believing that there's some moral difference between killing and letting die leads, unfortunately, to to patients suffering much more than is necessary. Second argument he makes is that it leads to decision making on irrelevant grounds. And here I'm not going to explain his argument in detail because I think he's mistaken here. But you should notice his account of how sometimes in the past his examples of a Down syndrome child have been allowed to die simply because they have a particular blockage that will kill them if left untreated. You can read about this on page 191, but you should be aware that his argument here is not really correct because no one who defends what I've called our sense that it's okay to let patients die in some situations would defend allowing that particular child that he cites to die. His third argument is more interesting and more to the point. He argues that in fact there really is no moral difference between killing and letting die, and since both have the same consequences, death, and he uses a very interesting set of scenarios to make this point. He writes, so let us consider this pair of cases. In the first, Smith stands to gain a large inheritance if anything should happen to his 6-year-old cousin. One evening, while the child is taking his bath, Smith sneaks into the bathroom and drowns the child, and then arranges things so that it will look like an accident. In the second case, Jones also stands to gain if anything happens to his 6-year-old cousin. Like Smith, Jones is planning to drown the child in his bath. However, just as he enters the bathroom, Jones sees the child slip and hit his head and fall face down in the water. With only a little thrashing about, the child drowns all by himself, accidentally, as Jones watches and does nothing. Now, Smith killed the child, whereas Jones merely let the child die. Did either man behave better from a moral point of view? Well, obviously, neither Smith nor Jones behaved morally in these scenarios. And Rachel's point is that since their behavior is reprehensible in both cases, and one killed while the other merely let die, then this idea that the distinction between killing and letting die makes any moral difference is simply wrong. Now, partly on the basis of the weakness of an argument like Callahan's and the compelling nature of some of Rachel's arguments, some defenders of the idea that active euthanasia is wrong have suggested that the key distinction is not between killing and letting die, but rather it has to do with intention, that intending death is always wrong, but merely foreseeing death as a result of one's action is not necessarily always wrong. So the key distinction has to do with intention. So from this perspective, folks would say, look, active euthanasia, giving a patient a lethal injection, is clearly intentional killing and therefore wrong. But when we withdraw or withhold a treatment, that is more beneficial than burdensome, what we've referred to as an ordinary treatment, there we could also only describe our intention as death, as killing, and therefore that's why withdrawing an ordinary treatment is wrong. So you see the point. If this treatment is truly beneficial to the patient, if a life-sustaining treatment is truly beneficial to the patient, those benefits clearly outweigh its burdens, how else could we describe a decision to withdraw or withhold that treatment except as an intention to kill the patient? However, now here's the key, subtle difference. When we withdraw or withhold a treatment that is more burdensome than beneficial, when we withdraw a treatment that does sustain life, but it's a life of such low quality and it adds to the patient's suffering, and the patient may be dying very soon anyway, so the benefits from this are not very extended. In a situation like that, where the burdens seem to be greater than the benefits, when we withdraw the treatment and allow the patient to die, we are foreseeing their death, but we're not intending it or seeking it. And that, for some, is the key matter of importance. Consider this passage from an essay called Active and Passive Euthanasia in an earlier edition of this textbook. Thomas Sullivan writes, "It is, after all, entirely possible to foresee that something will come about as a result of one's conduct without intending the consequence or side effect. If I drive downtown, I can foresee that I'll wear out my tires a little, but I don't drive downtown with the intention of wearing out my tires. And if I choose to forego my exercises for a few days, I may think that as a result my physical condition will deteriorate a little, but I don't omit my exercises with a view to running myself down. In general, then, it is not the case that all foreseeable consequences and side effects of our conduct are necessarily intended. And it is because the physician's withdrawal of extraordinary means can be otherwise motivated than by a desire to bring about the predictable death of the patient that such action cannot be categorically ruled out as wrong." Now, a couple of comments here. First, his use of the language side effects. That language, I think, suggests that we do, in fact, in our ordinary discourse and our ordinary talking and language, make a distinction between consequences of our actions that we intend and seek and those that we foresee but aren't seeking. A side effect of something we do is a consequence that was not a part of our purpose. When we go to see a movie, wearing out our tires is a side effect of driving downtown. When we give certain medications to relieve pain, unpleasant side effects are not what we intend, though we foresee them. So his point here is that when we withdraw a burdensome treatment, when we withdraw an extraordinary treatment, our intent is to reduce the burden on the patient. We foresee that he or she may die more quickly and probably will die more quickly. But that's a side effect. That's not our intention. And that's why withdrawing that treatment is permissible. From the perspective that Sullivan is developing, the key distinction upon which the traditional rejection of active euthanasia is based is not the mere distinction between killing and letting die. Rather, the important distinction has to do with intention. What we may not do is intend death, but we may act in ways that foresee death so long as death is not intended. And that's what happens when we withdraw or withhold a life-sustaining treatment. When we give a lethal injection, the problem is we are intending death. Well, in the next presentation, we will look further at this distinction and important challenges to it. That's next time in our analysis of the question of active euthanasia.